machine. Sit down. Yeah. That's this way. I had an experience on the ward. I go to wash my hands with soap, only to find that it's not. I go to dry my hands with tissue. Again, there is none. So I was left to be air dry. With enough scalding.
Very troubled times. They thought that the breast money. For you biopsies right here. But no concentrations out to come back. It's holding up the line. It ain't good.
These experiences that you're describing, we can't continue to operate on these conditions. I mean, it can negatively affect treatment for the patient, and the patient is always
Good day, everyone. Sorry to interrupt. Rubbish.
You got it?
As you may know, or may not know, I've been recently appointed to the post of Deputy Dean. As Deputy Dean, I wish to inform you that, as per usual, we have another set of students coming in this November, and they're eager to begin their clerkships. As Deputy Dean, Deputy to send to you a new memo on the treatment guidelines for retention as it pertains to property law and assault law.
But what is this? I'm the head of research department in the middle of a meeting.
Yeah.
Right, yes. I'm glad you mentioned that, actually. About eating. Yes, eating.
Eating?
I was a senior reg on Danish's team. Can't remember there being 80 students.
The intern just sent me to go take some bloods, but there are no syringes, and I had to bring gloves from home. Supplies real low. How do I expect this place to run?
You mean you have to bring gloves and all from home? I mean, I know we ain't got no medication, we ain't got no tools, we don't even have no alcohol to say we taking any bloods. But gloves? Oh gosh, things real grim. Anyways, you know what I feel for? Those third years. Really? What are you going to be working with? You hear how many of them coming?
I hear it's about 80 of them, but I wait to see how they fit on these words.
Good morning. Are we ready? Hello, where is Judy? Judy, so nice of you to join us this morning.
Good morning.
I heard we're getting some new medical students this morning.
Yeah.
I heard it's a really big class.
We are sorry, but the electricity bill has not been paid. Due to budget constraints, please stand by and wait for the generator to take full effect.
So, if there was no electricity, how did you make that announcement? Why? We have quite a bit of you. Oh, so, seeing that this is your first round with me, and I know that I'm not going to be seeing many of you again, there's one thing you must always remember. Always, when seeing my patients, remove your watches and tuck in your ties.
So, this patient is...
So, Julie, before we get to you, do we have a shortage of just about everything in the pharmacy?
Yes!
So, this is the 2-year...
Dr. Marvel, just give me a summary. Today's a lovely day for sailing. Students, if we finish rounds in, say, an hour, you'd get ice cream.
So, this patient is a 2-year-old and she's suffering from a stroke. And right now we have
Okay, do you have a footnote?
Well, this is perfect.
Oh. And what did her blood show?
Well, we couldn't do any blood tests because there were no red top, green top, blue top, purple top, you name it, top two here. And her family even had to go outside and buy these plants to protect them.
So they could not buy the tubes as well. What is her name again?
Jane Doe.
Oh. Hi, Miss Jane. Hi, Miss Jane. My name is Dr. Nike Thunderbolts.
Not thunder?
No, my name is Thunderbolts.
Who?
What is wrong with her?
She's hard of hearing.
But ma'am, I've been told that you had a stroke.
I can go home now.
No, you had a stroke.
Who?
But don't worry, you'll be okay. Is she understanding me? We need the old lady whisperer. Where's Dr. Joel? No, where's your magic? Grandson. That is enough. What was her blood sugar like this morning? How's her insulin? Did you write the sliding scale? I hope you know how to write the sliding scale, Dr. Marvel.
No, she's not diabetic.
She's not? So why is she on my service? I only deal with diabetes. Was this the last patient? Great, I'll be on my boat. Students, you can get your item in the lounge. This could have been a telephone rounds from my boat.
So you heard what that patient I went to see last week? Apparently he went to get his toe amputated and left the end with a continent.
So, hold on. You mean to tell me that he didn't know he was getting a BKA? No. You can't be serious. Hypocrisy must be turning in his grave.
That's what I'm trying to tell you. They didn't consent him properly. Hospital, they could run out of paper too. Because they didn't have any consent forms.
Paper? Something as simple as paper? Come on, man. Or you mean to tell me, like, maybe they were Russian and just didn't have time to consent him? Please tell me there's paper.
No, you heard it wasn't any paper. Man, I have to get this audit. It should be good today. Remember what happens in audit? Stays in audit.
Yeah, that's that we're good.
Good afternoon, everyone. My name is Javier St. Paul. Welcome to audit. Our team will be presenting a case that was found circulating overseas. In hopes they learn from their mistakes. Site 1, closed ulcer, and Site 2 shows a BK. The patient reluctantly agreed to have an amputation of his first hallux, but the surgeon thought it was necessary, went ahead and did the below-the-knee amputation. Again, of the patient's wishes.
No, man. So, you mean to tell me? We're not. Okay. Foolishness. Go on. Do we have consent forms? Or are they none?
Consent forms? We always have consent forms. You asking me that in truth? I am the head of surgery.
Only 60 years. Patient has not been consented to go to the medical. I agree with Walrond. There should be consent forms. Continue, Officer.
When was the last time the head of surgery was on the wards?
Monday morning for ward rooms.
Then you bring those this morning and carry them on the wards. Consent forms have been missing for months now. Months!
Alright, well, where was the senior rise up that it should be? Some patients are passing. And though the literature suggests that this is a common complication, after my first visit, there were no symptoms of pain in my patient.
Is there anything else you'd like to add to this discussion?
Well, this in itself is it's a very ethical issue. And it is imperative that the patient's autonomy be respected. A patient must always be properly consented for and made aware of any complications that may arise from the procedure at hand. To go beyond that which has been consented for is in fact unethical, very unethical. Unless, of course, it is inside of an emergency setting.
Okay, so I just want to get back to the issue at hand. The patient developed phantom pain and depression as a result of this amputation, and is threatening to obtain legal justice in the matter and is pursuing the hospital.
Yes, that is all fine and good. But you have a patient in theater who have consulted reluctantly. Now, what to? And you are telling me that they have taken off so and gone about just below the knee. Rubbish! This could have easily happened at this hospital. Not only do we have drinks, gowns, and stomach guns.
Of course we do. I think I saw some this morning, but only a few.
Yeah, we know what that means.
Large group of students anxiously wait on Ward C5 for Dr. Laurie Lord. Lots of nervous chatter in the air as no one has cleared the first patient to be presented on rounds from call last night. Boy, Rashona, you caught anybody? Girl, no, I ain't seen nobody yet. I don't think anybody caught anybody, but you know, Dr. Lord, he don't make joke, you know.
Yeah, he real serious. Everybody bring his paw and on his nuts.
I don't know, but hold on, where is he from? Is he from Jamaica or?
No nonsense, man. So let me go. Hurry.
Yeah, there we go.
I'm a Jamaican, I am a Jamaican, proud Jamaican, I am a Jamaican, and I are the black, gold and green.
That's me. You learn from him. So, wait. At this third years I see it. I see some familiar faces. You had sugar last night? Sure? Don't lie to me, you know. Let's just say, I hope you work as hard as your party. Because we're going to have a serious problem. Intern, what we starting this morning? So we start on with 7 of the Lord. So this is 70-year-old Mr. Johnny Walker. Respiratory tract infection requiring pneumonia. Hold on. Which 38 was this patient? What's your name?
Mary, what's your hand, sir?
Thank you, Mary. What can you tell me about pneumonia?
Full history.
No, sir. You want me doctor and you don't take full history from patient? No, sir. Come, what do you know about pneumonia? You heard what the intern said? Were you listening?
Yeah, I already said
Tell me what you know about pneumonia then?
It's a respiratory tract infection that can be fatal.
Fatal?
She don't know what she's talking about. What the hell? So is everybody who died from pneumonia?
No, sir.
So how do you treat pneumonia then?
Antibiotics?
Okay, you know something. So tell me which antibiotic would you use. Intern, I did a blood culture for him already.
Well, when he came in this morning, there were no blood culture bottles in here on the ward.
No blood culture bottles? Seriously? Did you find one after all? Okay. Wait there. I'm still waiting. Which antibiotic would you use?
Warfarin.
Not today, Larry, not today.
Warfarin? Seriously? How does this girl get to medical school? No, sir. Well. That's a very interesting antibiotic. Tell me, I can ask you a question? It's okay if I ask you a question. Tell me, which type of antibiotic is wrong? You don't know. You know why? This is not antibiotic.
Sorry, sir. I froze. It's a birth and I needed my body.
You froze or your brain frozen? Where's the brain? You want to be a surgeon? Wait, don't answer. Wait, who talks to you from college? Don't answer that. Just
Wait, let's see if she can find the blood culture bottle.
Hey, where's the brain? Come back here. You want to come back around?
Yes, sir, please.
Okay. Go on another one and find me a culture bottle. Don't come back empty-handed, yeah?
Right away, sir.
Right. So, who can tell me about warfarin? You.
If only we had hospital passes. Good morning, sister. My name is Mary Winterhead, and I'm a third-year medical student. Nobody calls us.
We have one. Wait, where are you coming from?
Sister.
We don't have anything over here for detail.
It was for a patient at the same hospital. You never heard of the ethical principle called justice?
Justice, I know always. You scratch my back and I scratch yours. And the fight nurse never do nothing for me.
But how could it be like that, sister? I mean, the resources at the hospital are in limited supply. We've got to share them equally, especially to those that are most in need. And my patient is about to die.
With all respect to you, sister, and your office, if it was your relative on a bed dying, you would have given you food and the culture bottle.
Number one, my relatives will be at Bayview. Just go ahead and take food, because you're just wasting my time.
Thank you.
Go ahead.
You believe me on Rose the other day, and the patient there gossiping with the patient on bed 7? Everybody in their manager know the man RVP. How they expect to maintain confidentiality on these words?
I tell you already, these beds are too close. I mean, when we have to be presenting histories to consultants, it's like we're shouting at them. Confidentiality is a myth around here.
Yo, I have to go. I completely forgot I had Warrond with Dr. Donald this morning.
I'm sorry, but you are precisely 1 second late. This unit
Oh, like a current has on birth.
Unlike the surgeons, we actually know what we're doing when we talk it out. I take it then you want to be a surgeon. First, you must introduce yourself to the patient. And after gaining consent, then you proceed. You use a chair to be comfortable. And then you work your way into each quadrant. Always maintaining eye contact. Internal medicine, a certain level of competency and is expected and required. And if you fail to meet that criteria, then surgery will be the best for you. Your hospital is approximately 80 hours away. And your abdominal examinations will be hours. I hope your cardiovascular examinations understand. Yes. No, let's not waste any more time. Let's continue. What's going on here? Are you ill?
No, because I have asthma, I have allergies.
Not beat. Did you believe that?
I suppose.
This kind of reaction that she's saying is allergies.
Oxytocin?
Clearly, I'm not asking this question correctly. What would you use to treat allergies? Anyone? Nothing. As I expected. Student T, continue with the remainder of the abdominal examination. You can proceed with the fluid.
Hi, ma'am. I'm just doing an exam on you, okay? Can you sit, please? Can you drink this?
I was supposed to, but there wasn't any soap on the water.
So now that we have lost the trust of our patient, I would not bother to ask you to elicit shifting notice.
Dr. Donald? I read from Dr. Donald's document. I'm very sure I could do it.
Okay, go ahead. There is Donald, Deputy Dean. Lecturer in clinical pharmacology and faculty of medical sciences. Yes. Okay. Brilliant. I'll meet you there in say 15 minutes. Okay. Brilliant. I'm sorry, but I have to go. We'll meet back in say at 1300 hours. Hopefully, by then, you should have all read upon your clinical examinations. We'll be doing the abdominal examination. By then, I expect you to know clinical findings, the pathophysiology, the pharmacological agents that we use to manage this patient. You have an
Okay. 15 hours, so yeah.
Sweet girl.
Any answers?
Sweet girl.
can practice this thing. Understand? Respect. Daddy says so.
No one emails in our phone. When I get distracted, easy. So I can close eye on you. Unfortunately, ladies, this is what you have to do. This is limited G right here. 29 interns, and out to the quality. 2 meals. And how many females doing better than you? Anyhow, let us begin. What can you tell me about the cardiovascular system? You. What is the first thing you do on an examination? After you introduce yourself and ask for consent.
You listen for heart sounds.
Start from the very beginning. You are missing out something.
But I'm more sure listening for heart sounds is the first thing I do.
What if it tell you is that your heart is and at the examination that tell it out? Well, alright. Nigga call it can't let go. You can't let go of the fact that you're wrong. Next. What is the first thing you do on examination?
Palpate peripheral pulses.
Oh dear, thank you. Somebody got a brain. I'll put on my eye. Next, you look real smart. You have to call your super doc.
I will drink you bath water.
Come here. Why are you so late for my session?
I had a hairdresser's appointment. It ran a little late.
Oh, well, pardon me for intruding on your Saturday. Well, I spend mine teaching.
Sorry.
No, don't be sorry. Be sorry you went to that hairdresser because she did not do a good job. Get here looking like a wet clothes.
Why her hair that color? She feels she a pop star? She feels she a Nicki Minaj?
Anyway, go sit. Hey, me don't see what you're wearing. Where you going with that skirt? Me know the hospital have shortages. You have a shortage in fabric as well. Don't come to my session wearing those kind of clothes again. It's because of one of girls when that got the man distracted. No wonder they can't get away. And they feel so good. On that note, everybody, you must dress appropriate. Girls, put the ear neat back in a bun or a ponytail. I don't want to see no French fries twiddle thing. Use your gel, grease, Vaseline, water, whatever to make that hair go back neat. I don't want to see no titties. Girls, make sure your skirt is down to your knees and your pants them cover your behind. I don't want to see a boom boom. I don't want to see an ass crack. Nothing so.
If only I remember back in second year what Prof. Granny was telling me in that class was shock. Why didn't you remember?
And there's 3 words that inadequate tissues per billion.
Yeah, boy. Thank God for Professor Granny, boy. He did a really good job.